Hello, my dear students. So today we are going to discuss regarding the Balwadi nutrition program. This is a important program which comes under family and welfare. Let me start the program. Now, see, the program was started in 1970 under the Department of Social Welfare, right? And we have given, like government, they have given a grants to the voluntary organization so that they can run this program successfully. Now, if we will talk about the beneficiaries, beneficiaries means who all will get the benefit from this program. So the beneficiaries are the preschool children who falls in the age group from 3 to 5 years, right? Now, what are the services provided by the government, or we can say that by the voluntary organization in this program? The most important thing is like we have to focus on the nutrition part. So whosoever is attending the school, the kid who falls in between 3 to 5 years, so whosoever is attending the school, he or she should get the nutrition, proper nutrition, for which is very important for the growth and development of the child, right? Another thing is we will always motivate, we will always educate the community, educate the family, educate the parents, like the preschool education, or we can say that education is very very important, right? So this is another service which comes under this program. Now, so when the ICDS program was implemented by the government, so the Balwadis that are also this program, Balwadi nutrition program, that also merged under this ICDS program. Now, next is what is the requirement of the program? See, the cases of malnutrition is very, very, very common in community, or we can say that the rural areas, rural community, or we can say that underprivileged areas, right? So, to reduce these cases, to reduce the chances, or we can say that cases of malnutrition in India, in all these underprivileged area, the government has started this program. So, they basically what they are providing the meal to the child, and the meal is that meal contains a well balanced diet, we can say that. Well balanced diet means it contains everything. It contains carbohydrate, it contains proteins, it contains minerals also, vitamins also. So that means we are providing full fledged meal to the child, right? So that we can reduce the cases of malnutrition in that particular areas, right? So this is the basically main requirement of the program. Or we can say that, see, the underprivileged child, underprivileged population or parents, they never allow their kids or their child to go and attend the school, preschool, right? So this is the way we will attract the parents, like we are providing meal to the child, we are providing free education to the child, so why can't you send the child to the school? So this is the basically requirement of the program. Now, next is what are the aims of the project? See, we have already discussed like the underprivileged families. They obviously the cases of malnutrition are very high over there because their earnings are very less, right? So we will encourage the parents to send their child to the school so that they will get the good nutrition. So our main aim is to reduce the cases of malnutrition in India, or we can say that in a particular area, right? So this is our main aim, or major thing which comes under this project. Another thing is, some of the time I feel like when I visit the community, when I will communicate the family members or communicate with the parents they have their another thought in their mind. क्या करना है स्कूल भेज के? एजुकेशन इज नॉट इम्पोर्टेंट, क्यों भेजना है? क्या जरूरत है स्कूल भेजने की? हम भी रिक्शा चलाते हैं, ये भी रिक्शा चलाएगा. So you have to educate them. Like if you will educate your kids, you will educate your family, your children, so definitely your standard of living will increase, right? So this is the basically main aspect of this program. Another thing is, like as we all know that हम सब न्यूज़ सुनते हैं, बहुत सारी चीजें हम न्यूज़ में देखते हैं, like the kids who are living in the poor families, or we can say that the kids who are living in the underprivileged areas, they are basically exploited by the other public, or we can say that the people who are living in the they who are having a high standard of living, right? We can say like that. So we want to reduce this exploitation. We want prevent them from exploitation. So this is the way we will that is why, or we can say that this is the way we will educate the public. We will educate the parents. Like we will. This is the thing when you will educate your kids. Next thing is, see, basically these underprivileged areas, these are the areas where we or we can say that we are not able to provide the medical support properly, right? हम हर जगह कैंप्स कर लेते हैं, हम प्राइमरी हेल्थ सेंटर में भी कैंप करते हैं, हम कम्युनिटी हेल्थ सेंटर में भी कैंप करते हैं, हम सब सेंटर में भी कैंप्स करते हैं, हम जो जितने भी एरियाज है वहाँ कैंप करते हैं, अर्बन में भी कर लिया, रूरल एरियाज में भी कर लिया, but we will never focus on those areas where these medical camps are required, जहाँ पे बहुत ज़रूरत है medical camps की, कहाँ पे? That is underprivileged areas. Why? Because there is some lacking in medical services over there. उनको नहीं पता होता हमें कहाँ जाना है, कहाँ अप्रोच करना है, where we have to go, where we have to meet, किसको मिलना है, किससे जाके मिलना है, कैसे बात करनी है. So they hesitate to visit the sub center, they hesitate to visit the primary health center and community health center. Though ये सारी चीजें उनके एरियाज के आसपास अवेलेबल हैं, but they actually don't know कैसे अप्रोच करना है, कैसे जाना है, किसको जाना है. So when you will organize a medical camp for them, or we can say that as a professional, medical professional, when I'm going to organize a medical camp for them, so they will share a lot of things with you. I'm having this issue, I'm having this issue. So then you can refer them to the primary health center, or we can say that community health center is there, or some district hospital is there, right? So after assessing their condition, you can train them, or we can say that you can educate them. Now this is the hospital जहाँ पे आप जा सकते हैं ट्रीटमेंट के लिए, you will get good treatment there, right? So basically these are the aims of this project. Now, next is implementation. See, when this program was started, so this program was started in 23 Balwadis, which are located in different slums in Andheri West, right? At these places, at these 23 areas, what we did, what the government did, they have provided a trained teachers to them. Right now, these trained teachers, they educate the kids through AV aids, through music, through rhymes, through play, by showing the dramas to them, by showing puppets to them. They have narrated so many stories for them. बहुत सारे सॉन्ग सुनाती हैं उनको, जिससे क्या हुआ, they able to learn the importance of hygiene, they able to learn the importance of nutrition, they able to learn the importance of hand washing, right? So lot of things are there which we want to inculcate in these kids, right? Okay, another thing is, see, as we all know that basically क्या होता है कि जितने भी बच्चे होते हैं, they basically attracts from the colorful things, like जैसे अगर आप नर्सरी की राइम सुनाएंगे, सॉन्ग सुनाएंगे, कलरफुल पपेट्स दिखाएंगे, टीवी में कुछ दिखाएंगे, ड्रामास दिखाएंगे, they will be very happy and they will learn all this, they will learn lot of things from these things only. क्यों? क्योंकि वो visibly वो देख रहे हैं. So when you will see, you will learn a lot, right? तो आपकी मेमोरी में वो एक पिक्चर छोड़ जाता है कि हाँ, आई हैव लर्नड इन द स्कूल दिस थिंग, so I know what this is the importance of hand washing, so I have to wash my hands before eating the food and after eating the food, right? So this is the thing which we want to inculcate in our kids, in our future generation, right? So these balwadis, they have started all these things in their balwadis. So they have trained teachers, so teachers, they educate the kids, they educate the preschool kids, regarding the importance of personal hygiene, regarding the importance of hand washing, regarding the importance of food, क्यों खाना पूरा खाना चाहिए, why we have to focus on the fruits खाना क्यों important है, right? Another thing is, as we know that now the lot of things, like in most of the organization, we are giving preference to the English language, so we have introduced a concept of English also in the Balwadis. So we have started educating them regarding A, B, C, D, so that we should, they should know what is all these are the concepts which comes under the English, right? And the government, they have provided, or we can say that the voluntary organizations, they have provided some toys also in the Balwadi, so that they should get free time to enjoy also, right? Now next is methods. Yes, see, the government, or we can say that voluntary organizations, they have adopted a lot of methods in the sense, like like the first thing is like we will say that like we have already started 23 balwadis in Andheri West. So in these balwadis, they have admitted, or we can say that 31 children are there in these 23 balwadis. Averagely, we can say that, and the age group of children are from 2 to 6 years of age, right? Another thing is the kids, they used to spend 3 hours per day in that particular balwadi, right? So in these 3 hours we used to serve food to them, right? And I think we will educate a lot of things, we will inculcate a lot of good habits in the child, right? Another thing is the balwadis, they are providing supplementary food to them. Supplementary food means we are providing a well balanced diet to the child. One meal is provided to the child, and that is well balanced diet to the child, so that we can reduce the cases of malnutrition. Another thing is balwadis, they, what they did, they used to measure the weight of the child. Every month they measure the weight of the child, and they when they will conduct some parent teacher meeting, जैसे हमारे स्कूल में भी होती है, बच्चों की होती है, उसी तरह से बालवाड़ीज भी क्या करती थी, दे यूज टू प्लान पीटीएम, महीने में एक दिन पीटीएम करते थे, दैट इज पेरेंट टीचर मीटिंग. एंड इन दैट पर्टिकुलर पीटीएम दे यूज टू शो द रिकॉर्ड्स टू द पेरेंट्स कि जब बच्चा आया तो बच्चे का वेट इतना था, अब बच्चा 15 डेज के बाद हमने बच्चे का वेट मेजर किया, अब बच्चे का वेट इतना है. नाउ 1 मंथ हो गया, नाउ द वेट ऑफ द चाइल्ड इज दिस. सो they are maintaining the proper records and reports, so that they can motivate the parents also. See, this is the importance of food, this is the importance of balwadi, that is why we have started this program. So keep motivating others also. बाकियों को भी जाके बोलिए कि आप अपने बच्चे बालवाड़ी में डालिए, so that the kids can improve a lot of things. Okay. Another thing is, see, when we are, or we can say that when Balwadis, they used to conduct PTM, जब parent teacher meeting करते थे, they used to give a healthy gift to the child. Healthy gift to the child in the sense, sometimes they will give a gift of fruit basket to the child, or sometimes they will, they will give some coloring book with colors to the child. So that is a healthy child gift, right? Now, another thing is, as we know that, like, suppose if some child is visiting my Balwadi and someday he is absent from the Balwadi, he didn't report in the Balwadi. So the Balwadi people, they used to visit the person's house, like why child is absent, what is the reason behind that. If child is sick, so they immediately provide treatment to the child. They immediately refer the child to the medical officer, so that the treatment can be given to the child at immediate point of time, right? So proper supervising and monitoring, or we can say that we will monitor the program, or the medical officers, the program coordinators, the field coordinators, program officers, they used to supervise the people who are working in the balwadis, so that we can monitor the implementation of the programs, right? Another thing is, so when you will conduct a medical checkup for the kids in the balwadi, so basically they give focuses on the eye checkup, right? Because eye aajkal, as we all know that the kids are more attracted towards phones and all, टीवी बहुत ज़्यादा देखते हैं बच्चे, तो कहीं ना कहीं बच्चों की विजन कमज़ोर हो जाता है, right? So the health camps has been organized by this voluntary organization, these balwadis, and basically they focuses on the kids eyes also. Now what is the status of kids eye? Sometimes the kid, हिम और हर सेल्फ कंप्लेंट, यो मेरी आंखों में बहुत दर्द हो रहा है, बहुत टीवी देखता हूँ, राइट? So this is why we are, or we can say that Balwadi people are organizing camps for the children, right? So that we can immediately at that point of time we can provide treatment to the child. Next is, we help children to get into local schools after pre-primary. Yes, after completing the preschool education, we will always encourage the parents to send the child to some other school for the further education, right? So in all these things, the Balwadi people will help the parents, right? They obviously they will explain them, this is the procedure. आप इस स्कूल में अपने बच्चे को डालिए. See, underprivileged families or पूरा poor families, they don't have money, राइट? उनके पास पैसे नहीं होते कि वो प्राइवेट स्कूल्स में बच्चों को डालें. सो व्हाट बालवाड़ी पीपल डिड, दे ऑलवेज मोटिवेट देम कि दिस इज अ गवर्नमेंट स्कूल, यहाँ पे फीस नहीं है, यहाँ पे एजुकेशन फ्री है, यहाँ पे बच्चे का यूनिफॉर्म का खर्चा भी नहीं है, यूनिफॉर्म इज ऑल्सो फ्री, and books are also free. आपको कोई खर्चा नहीं करना है. So you should send your kids to this school so that child should complete his or her education till 10th or 10 plus 2, right? Now, see, after when I have attended this Balwadi program, and I have seen, so I have attended parent-teacher meetings also. So when I met the parents, who was attending this PTM in Balwadi, they used to say that वो उनके दिमाग में ये चीज बैठ ही गई थी. प्रीवियसली देयर थॉट प्रोसेसेस, क्यों बालवाड़ी में भेजना है बच्चों को, क्या है, हम भी तो खाना खिलाते हैं, वहां जाके बच्चा 3 घंटे क्या करेगा. बट now the concept has been changed after they have seen what is the importance of balwadi. So when they will see the improvement in their child, improvement सिर्फ food में नहीं हम कहते हैं, improvement is all from head to toe, right? Head to toe means बच्चे का ब्रेन डेवलप होता है जब आप ग्रुप में बैठते हैं, जब आप अपने पीयर ग्रुप में बैठते हैं, राइट? आपका ब्रेन डेवलपमेंट होता है, आपका पूरा बॉडी का ग्रोथ एंड डेवलपमेंट होता है. सो दैट इज वेरी 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 इंपॉर्टेंट. So when I met with the parents, so parents used to say that कि गुड दे आर प्रोवाइडिंग गुड फूड. जब मेरे बच्चे को खाना अच्छा मिलता है, दैट इज इक्वल्स टू वेट इंक्रीज. ऑब्वियसली जब मेरा बच्चा खाना अच्छी तरह से खाएगा, हेल्दी फूड खाएगा, सब कुछ खाने को, उसको एक मील अच्छी तरह से खाने को मिलेगा, डेफिनेटली द वेट ऑफ द चाइल्ड विल इंक्रीज. जब मेरे बच्चे का वेट इंक्रीज होगा, दैट विल लीड्स टू अ बेटर न्यूट्रिशन. इसमें देर इज नो, दैट मीन्स देर विल बी अ नो कंसेप्ट ऑफ माल न्यूट्रिशन, राइट? This is the way we will always motivate the parents to attend allow your kids to attend the balwadi, so that there should not be a concept of malnutrition in India. Thank you so much for watching my video. So for more learning or community health bites, please subscribe my channel. And if you want me to add some more videos on some other topic, if in whatever topic you are interested, so you please mail me, right? Thank you so much.